Welcome back, everyone. For those of you who haven't joined us up until now, my name is Snowdon. I'm the Scientific Director and CEO of Scan Health. I am also the Director of Clinical Research at the HIMSS Global Network. And I am absolutely delighted to share with you the work we've been doing since the HIMSS Network launched the Clinically Integrated Outcomes Maturity Model just prior to the onset of this pandemic last November of 2019. Talk about timing. You never know what tomorrow brings, as my mother used to say. If we go to the next slide, it really just captures a snapshot of just a few of the incredible areas of impact this pandemic has really demonstrated and shone a very bright light on. For virtually every global health system. If you were able to join the panel just prior to this presentation, there's tremendous depth of learning and lessons learned and understanding of where and how global health systems can now move forward and perhaps even accelerate progress towards a much more robust, digitally abled, clinically integrated supply chain supported by a maturity model that really creates this pathway, if you will, or the road to this future. In this COVID, this is you can see in this picture actually the incredible numbers of protective equipment our global health workforces are requiring to wear to stay safe. Despite even that much protective equipment, health workers are sustaining infection with the COVID-19 virus at extraordinary rates, which of course vary in each country. But it is probably the first time supply chain has so clearly demonstrated the link between a capacity of a supply chain to respond to sudden demand and the health and workforce safety, the safety and health of our workforce, but that then driving the capacity of a health system workforce to meet the demand, offer that safe and quality care to virtually everyone who needs it. The early phase of this pandemic demonstrated very critical shortages of product, and that has transformed how health systems are now thinking about supply chain. Formerly, it was about how do we get the best quality products at the lowest price, and that was the dominant supply chain strategy. Today, how do we absolutely make sure we have a resilient supply chain, one that regardless of the demands, the surge required of those supply chain infrastructure is able to respond to that infrastructure and able to ensure that every health system can deliver on its mandate to global populations. That will be critical as we all see now the vaccine strategy unfolding just today. Leads Trust in the UK has begun vaccinating with the Pfizer vaccine. That will unfold very quickly for most health systems globally, and it will be the supply chain that actually makes that possible and viable to meaningfully impact the progress of this pandemic. If we go to the next slide, I think the other very significant outcome of the pandemic, which I'm not sure any of us anticipated actually, is this very rapid emergence of virtual care. Dr. Joe Drozda referenced that in his presentation. They were one of the earliest virtual care centers in the US to design new healthcare delivery models virtually to connect meaningfully to the many patients that need them. Most health systems didn't have that much time in planning and thinking going into their virtual care strategy. They literally turned it on overnight. So that raises a number of questions in terms of how do we measure quality and safety in virtual care environments? What does supply chain look like in virtual care environments? How do we track and trace the outcomes right to that individual patient level when all of those care delivery processes are now being delivered virtually? So that future and that next step for many of the global health systems will really have to contemplate and ask those very critical key questions. Just along that line at HIMSS, we're actually going back through this maturity model and many of the other maturity models to now bring forward that critical importance of that outcomes tracking and tracing that contemplates and acknowledges the importance role of virtual care. In the next slide, we'll really I want to speak to just where and how does supply chain, and more specifically, the clinically integrated supply chain maturity model fit within that broader digital health ecosystem. Hal Wolf, our CEO of HIMSS, will be speaking about digital health and where that future is going. But when you think about it, these are essentially the building blocks and the key dimensions of digital health based on the HIMSS digital health ecosystem framework. At the baseline, of course, you have to have a very strong, very robust governance and policy frameworks to overcome the challenges that we're seeing, for example, within inequality. You also have to have very strong workforce policies, frameworks, and tools to ensure the health workforce can and is enabled to deliver a digitally enabled care process, such as what we're seeing with virtual care. But that's just the foundation. What builds onto that foundation is the dimension of interoperability, democratizing data right across the journey of care. You heard Dr. David Berridge speak of those use of global standards that can help identify in real time exactly where every individual patient is in the lead's care environment, and as they can track as they move from their admission to their surgical process right to their recovery and transition home. So interoperability is a key dimension to make it possible for not only patients and families, but clinician teams to know exactly how a patient's journey of care is unfolding, where those risks potentially are, and how we can proactively ensure the patient's recovery and transitions are safe. None of that is possible, however, unless you have very sophisticated analytics and the opportunity to track and trace outcomes. And that's the center point of the clinically integrated supply chain maturity model. It's how do we now connect all of that product attribute data, its source, its manufacturer. Think of that in terms of the vaccine. Which vaccine was administered to each individual or each citizen in which country? Did they get the second dose? What dose did they get? Was it the 4 weeks apart or the timelines it needed? And did it have the outcome? Health systems will not be able to easily do that until they advance a clinically integrated supply maturity model framework in order to create that digital infrastructure. When those things come together in digital health, that's where health systems actually achieve digital capacity. The ability to meaningfully connect the health system teams to every individual citizen, community, and population to drive and support population health and wellness. You heard today from our panel this morning that different countries and approaches, the very common feature of Mercy and Alberta, and certainly in the UK and NHS trusts, is the advanced digitally enabled data infrastructure they are working with, and very sharp focus on the clinically integrated supply chain. If we go to the next slide, we'll walk through just exactly what do we mean when we say clinically integrated supply chain. I get that question a lot, and typically the average view of supply chain is the team that goes and procures and sources those important products, make sure they are distributed and delivered to the health systems or health organizations who need them. And the HIMSS CISOM model, clinically integrated supply chain, reaches much further than that. It is the tracking and traceability of products, care processes, provider teams, all linked to and mapped to individual patient outcomes. That's what generates the real world evidence of value David Berridge spoke to understand what care is every individual receiving, what products were used, did that care achieve the best possible outcomes? And if not, how do we shift that care model to ensure every individual has the opportunity to achieve those best outcomes? And that's a key driver of what will be needed to overcome inequality, as Dr. Kevin Fenton shared with us earlier in the panel discussion. How does it do that? The next slide starts to show us just at a very high level. It essentially creates the roadmap for health systems that connect and integrate data that is collected in the patient electronic medical record system, integrate it with the ERP data, enterprise resource management infrastructure, so that now you get a very integrated data set. You can apply those analytics, those predictive analytics, that now not only document what care has been received by whom and under what conditions are we achieving best outcomes or perhaps not the best outcomes. And that then allows you to predict in future who are the patients that are most likely to be at risk for poorer outcomes, so that we can proactively identify them, wrap around those preventive, proactive care decisions among clinician teams to make sure that those risks never materialize, and that's how it advances quality and safety. The next slide takes us to a much more drilled down focus of what does that mean and where would health systems start as they adopt the CISOM tool and start to, along their roadmap, their strategic roadmap to a clinically integrated outcomes model. It all starts with global standards. You heard that this morning with David Berridge, and just how critical it is to have global standards able to allow tracking and traceability right back to the manufacturer of the product, the identity of the clinician team that work closely with that patient, and the many supplies and critical steps in the process that were implemented. That then moves and progresses towards inventory optimization. That allows for product traceability. You heard the Leeds Trust is now able to track and trace every product, identify that product in 90 minutes, exactly who received it, where that product may be sitting on a shelf for a product that's either recalled or perhaps expired. Those then, when about level 4 of maturity, that's when health systems now have that data to advance and improve and inform decisions on quality and safety outcomes, transparency for patients and their families, so that patients now can start to follow along their progress along their journey of care and whether and how quickly they are able to reach their personal health goals. Predictive AI tools, that's the advanced analytics of the future that now help our health systems move towards that proactive approach to identify people at risk, prevent those risks from materializing. And that's really ultimately when you get to level 7 maturity, achieving a personalized health system, personalized right down to, as David Berridge shared with us this morning, the individual T cell that's tracked and traced as a therapy for patients with leukemia, and then many, many, many other examples of personalized care delivery. Next slide. We'll show you really what does the maturity tool actually measure. It actually measures the 4 key dimensions, all created and informed by best evidence and research literature. Automation, to what degree is the care environment automated? So if I'm the nurse at that bedside, how easily is it when I scan that patient's barcoded ID band and I scan that medication I'm about to give, does it immediately and automatically tell me if I got the right patient, right drug, right dose, right time, right route, and all of those safety double checks that nurses and physicians do mentally without the automation in settings that don't have this type of digital maturity. Clinical integration, we heard a lot about that today from Dr. Drozda, Dr. Berridge as well. The very, very central, important role of clinicians who in the course of this pandemic, and it may well be one of the silver linings of such a devastating pandemic, that clinician teams now completely understand the critical role and strategic asset of supply chain in making it possible for clinician teams to manage the demands for care, but also to enable them to deliver care safely so that they're protected, their families are protected, and patients get the quality care they need when it's most needed. Predictive analytics is the 3rd dimension, of course. As you mobilize this data from all the ERP product side and you mobilize that patient care data from the EMR side, you've got to have the data analytics that transform that data into knowledge and insights, which of course inform decisions. And the 4th, but by no means the least, is governance and leadership. Those are the policy frameworks, the leadership, knowledge and understanding and vision that clearly recognizes supply chain as a strategic asset in the organization and a tool that when you advance its digital maturity, contributes and accelerates progress towards a digital health ecosystem that drives not just quality and sustainability and capacity, but it builds confidence in populations that know and are confident that care will be there when they need it to be there and supports them to stay healthy and well. In the next slide, I'll share just a little bit about what we're hearing and seeing in organizations that have actually achieved significant maturity in this digital clinically integrated outcomes model. This slide's an interesting one. As you see the circles on the slide get larger, you see the size of the complexity that represents the level of complexity. In many healthcare organizations today, we rely very heavily on data, but we tend to rely data to get collected after events have happened. We analyze that data for quality and safety and cost and many other outcomes, and then we make decisions. It's best perhaps described as reacting and responding. What a clinically integrated supply model offers is shifting and transforming, not reacting and responding. In other words, don't wait for something to happen. It actually proactively predicts, models, forecasts, so that health teams now have the evidence to inform, how do we make sure our patients stay healthy and well? How do we make sure those never events never happen? And that's shifting towards predicting and acting proactively to keep people well. So it's a very significant pivot, building on the strengths of health system infrastructure and driving that predictive, proactive focused on keeping people well as maturity levels increase over the course of the implementation of clinically integrated outcomes model. In the next slide, I think we can, I'll share some outcomes and where have we seen progress. And I'm sure you won't be surprised that if you were joined us in our panel this morning, the 3 health systems that have really demonstrated tremendous progress, the first one being Alberta. Alberta Health Systems over the last 7 years has documented in financial statements, audited financial statements, over $300 million in savings. And that savings is only tied to product waste. So not ordering too many products, only ordering the products needed because they can very accurately forecast demand. And they've made that it has been one of the strongest health systems in Canada as the first wave of COVID unfolded. They were the one province that did not have PPE shortages, so much to the point they actually shared with those provinces like Ontario who did have shortages, and were able to do that because of this tremendous accuracy in their digital infrastructure around supply chain. In the next slide, we see the outcomes for the NHS. NHS embarked on the Scan for Safety program, which was driven very much by GS1 UK, and has demonstrated incredible results. Leeds, David Berridge is one of the clinician leaders at Leeds, was one of the 6 first NHS trusts to implement this clinically integrated outcomes model. He shared a number of their outcomes, like reduction of never events, but also savings of almost 16 FTEs in nursing care that could now be redeployed to other areas because of the automation of those clinical environments. They have a 4-to-1 return on investment from inventory waste, and that was actually 2 years ago. I suspect it's much higher now. And by the time, if they project and implement across all of the NHS trusts, NHS would expect to save over £1 million savings, 30 million actually per month if it was implemented to all trusts. So they are well on their way to scaling that solution and sharing those incredible benefits. And the last is, of course, Mercy. Joe Drozda shared some of their key outcomes. Mercy was also a health system in the US that did not experience some of those supply shortages like many did. They've had phenomenal savings posted over the last number of years, $1 billion of savings, again, only tied to supply waste or lack of supply waste. But also they've captured 29.5% decline in labor costs, 33% decline in supply costs. So if you think about it, by automating and implementing this clinically integrated supply model, the savings start to actually pay for itself and the implementation. And they drive long-term savings because we're finding with these 3 systems and others like them, they're able to generate annualized savings year over year. It's not just a one-time set of outcomes. Next slide. So where and how has the CISOM model been adopted? This is actually just a few of the countries. You can see over 100 organizations are actively using CISOM. I think it's actually well over 100 now, as I am engaging and working with a number of health systems globally, Australia, Brazil, Europe, of course, all over North America. And that, now remember, it was just launched by the HIMSS network in late November. The pandemic followed right on the heels of it. So even given the tremendous challenges health systems have been facing, the very rapid adoption and uptake globally has been impressive. And the next slide will show you what does or how does this model actually help health systems make decisions. This is too small to read, of course, but what the gap reports, or once a system completes an online self-administered tool, all the indicators are completed by the teams at each organization. It gives you a detailed drill down overview of where are your key strengths, what have you achieved. So in this graphic, you can see there's been tremendous strengths achieved at level 5 in the area of clinical integration. A governance leadership workforce approaching level 6 with tremendous strengths, where they're now really needing to zero in on. It's data integration, but predictive analytics is a better way to say that, and advancing automation as well. So really what these supply chain tools offer, or the maturity tools more broadly, is they give you a deep dive and an analysis very objectively on what are your strategic assets you can build on, where might a health system want to consider investing to advance each dimension of digital maturity to move towards a much more highly mature or developed data infrastructure for clinically integrated outcomes model for this one. There are a total of 7 maturity models. Each one of them drills down in very specific areas. There's one uniquely devoted just to advanced analytics. So with the outcomes you see on this, you would probably then work with that team to look at the analytics model to really advance their capacity to drive advanced analytics to further advance their digital maturity in supply chain. If you go to the next slide, and this is really a wrap up of some of the things I think you've heard in our previous presentation, certainly with the panel, but it builds on a paper published by Don Berwick right at the height of the first wave. And it captured my attention because I thought it really brings together the key challenges, but the key opportunities that virtually every health system is now facing. And he makes the very critical point that fate will not create the new normal, but our choices will. And he points out 6 or 7 of those choices to be considering very carefully. And remarkably, I think we've heard about a number of them in our Path Forward conference so far today. The speed of learning. It is no longer likely to be the case that health systems are going to take 15 years to create a new therapy, like a vaccine, for example. They're now able to do this in a matter of months. The value of standards. Supply chain digital maturity will stand and fall on those global standards, because if you don't adopt those global standards and you don't have interoperability standards that allow data to flow across the journey of care, then we can't mobilize data in a way the clinician teams or health systems more broadly can make sense of them. Those standards are fundamental in being able to build on and not better understand the impact and the outcomes virtually every health system is achieving. Protecting the workforce. If there is one outcome in this pandemic that I believe will have a very long-lasting effect, is the link between supply chain capacity to ensure that absolutely every worker, whether it's the clinician, whether it's the staff and admitting, it's the security personnel that's helping us all be safe, or it's the housekeeping staff turning over those beds fast enough so that patients get the care they need. Protecting the health and safety of our workforce will be absolutely fundamentally critical. The role of virtual care, nobody I don't think would ever have guessed we would have pivoted that quickly. From one organization in the US shared with me that each year they used to do about 1,500 virtual care visits a year. They were now doing 1,500 a day, and that was a very small organization in one of the smaller states. Virtual care is a new way to connect to patients and families. We are absolutely needing to be very, very clear on what that virtual care is achieving, what outcomes it is driving, and how do we make sure we optimize those outcomes. Preparedness, we heard a lot about that today already. Being prepared, this will not be the last pandemic, and it was building on the legacy of many prior to that. The SARS pandemic is something that was very, very substantive impact in Canada. But we didn't invest in some of those supply chain infrastructures that we could have. Now we are now living with that lack of investment. Preparedness, I think, will take front or center stage. And overcoming inequality, that is probably the other incredibly compelling outcome of this pandemic. It changed the world for certain populations more so than others. How do we make sure health systems are equipped to manage and understand that inequality outcome and proactively make sure that absolutely every citizen has access to the best possible outcomes? With that, thank you all very, very much for joining me today. And I am thrilled to introduce Hal Wolf, a strategic partner in this maturity model work. And Hal is going to facilitate the Q&A. Thank you for joining us, Hal.
Pleasure to be here, Anne, and it's great to see you, and thank you for an incredible keynote.
Thank you.
We literally, because just so much to pull in, have a few minutes, so let's try and get one or two really critical questions in. And there was one from David and the audience, and Anne, okay. Is there a connection between CISOM and MRAM? And can a health system achieve a high level of MRAM without integration of medical device data included on the EMR?
Yeah, that's a great question, David. Thank you so much, and not an easy question, so make me work harder. MRAM is, in many ways, the 7 maturity models at HIMSS are all deeply connected to digital transformation. MRAM is advancing digital maturity of electronic medical records. You can't likely get to level 6 or 7 on a clinically integrated outcomes model without having a fairly advanced MRAM level. And David's absolutely right. If we're going to track and trace every care delivery process and procedure and every product like a device, that system would have to be able to capture that identifier for that device for every individual patient. We're going to have to figure out a way to do that with this vaccine coming up on the pandemic, but that's not the only product. There are many of those products, and that will, when you start to bring combinations of these maturity models together, it will accelerate the progress all that much faster. So very, very important question. Thank you.
Yeah, it's an interesting question too, and I'll just add on to it, Anne, and get your thoughts. Naturally, device data will come potentially through the EMR. But device data will also wind up integrating itself into clinical decision support applications,
right.
Artificial intelligence components that may just produce an outcome that goes to the EMR. So, right. How do we start to play with that? And does the same impact occur in supply chain, where you have this flow of information, some of it going into an EMR because it's a critical component of usage and inevitably billing, and as well as outcome at the clinical level, and then how do you tie that back in for consumption outside that isn't documented within the EMR? What's that crossover?
Yeah, it's such a good question. More and more, the EMR and MRAM in particular was really developed and has advanced tremendously, actually, digital maturity in hospitals. The issue becomes a lot of citizens actually don't spend much time in hospitals. So that raises the whole issue of interoperability. How do we accelerate the interoperability between the EMR at the hospital, the community care center, the primary care office, and connect to citizens? So if I'm that person who's walking around with that new knee implant, for example, the interoperability question is going to be front and center for that device data to know who made the device, what's it made out of, what are the outcomes, and am I able to report those outcomes? Those are all key features of the digital health indicator that HIMSS launched in the spring, and tie right back to mobilizing that supply chain data to connect to the EMR data and personal health records that patients are now connected to in our communities. The key challenge, and I hope will be key areas of investment, is how do we now blend and bring that interoperability for the multiple and different clinical systems out there, because patients very, very much need us to, and outcomes will stand and fall on our ability to do that. So it's a very critical question we're going to need to answer and drive forward on, for sure.
Yeah, and I would also talk and come back to one of the key points in CISOM, traceability.
Yeah.
What keeps me awake at night, as I'm sure it does you, is that if I consume something and I need to find it on a recall, and now it is 3 or 4 years later,
right,
and that patient has moved from one province to another, one state to another, how do I go and find that individual and bring them back? We have such a gap, as an example, in the United States because we don't have a national patient ID.
Right.
So I've got to go and try and find and match that up. And that really becomes a challenge.
Right. It certainly does. In many ways, let me throw this out, Al. HIMSS becomes that integrator opportunity, because those 7 maturity models, essentially, when you bring those together, drive digital transformation. And you're absolutely right. Canada is a country where every citizen has a unique identifier. So we have the identifier that the US doesn't. We don't have that integrator to actually take advantage of that strategic opportunity. I believe, and I really do hope, that very bright light this pandemic has shone on these critical questions will mobilize not only the knowledge and awareness, but the innovative thinking and opportunity now to drive that agenda. We certainly need it, not just to get through this pandemic, but to get through many other events, undoubtedly, health systems will face in future.
Well, here, great point, and that is the aspiration, and that is what makes it so exciting, with the chance to make that impact. I want to come back on our last question and ask you this fundamental question. You mentioned that a few organizations that are doing very well in clinically integrated supply chain and their journey. If you had to identify the top couple processes that you think got them to where they are today, what would they be?
Based on a lot of years of research, the first and foremost, not the only, but the first one, is the very senior leaders have a keen awareness and knowledge of the strategic importance of supply chain. I was interviewing for a national study here in Canada just a few months ago, and one of the supply chain team members, leaders, actually said to me, "Anne, we've been at the bottom of the bird cage for decades. Now people finally get why supply chain is so critical." So that would be one. Number 2 would be data and data accuracy. Health systems are, as one Australian colleague shared with me, data rich, insight poor. So it's the accuracy of that data, so that it doesn't matter whether that data got captured in Sydney, Australia, Montreal, Quebec, or Berlin, Germany. It's traceable. And the transparency that that brings, with the ability to capture that data, flows right through a health system. It's that transparency, in my mind, builds the confidence of the workforce. You heard today that you will have the protective equipment you need to be safe, and maybe more importantly, builds the confidence of the populations we serve, who will ask questions very front and center, like, is this vaccine safe? Like, we're seeing that today a lot. Building confidence, that comes from transparency and openness and dialogue and engaging people to make sure they are well aware of the many options and choices and impacts of no matter what decision you make. There will be great impacts, there will be challenging impacts. But that transparency in my mind is critical.
A beautiful way to end this session. And I want to
Thank
thank you so much for these incredible comments. Thank you for the questions that came forward from the audience. I know we'll all be working not only in the rest of these sessions, but moving forward to really capture that transparency and capabilities across the ecosystem. For everyone, thank you so much for joining us and joining Anne for incredible feedback. We are going to take a 25-minute break to make sure that we come back on time. We wanted to extend this last session an extra 5 minutes just because it's fantastic. So thank you so much. We'll take our break now and see you in 25 minutes.